Friends, welcome back to the show Talk with Your Doc, and with me is Dr. Abu Bakare, and today we are talking about obesity. Dr. Bakare, we were mentioning about various causes and risk factors for the obesity and the diseases caused by it, and the incidence is growing every day. What do you think is the cause for increasing the incidence of obesity in adults as well as in children?
Well, the cause, if you look at the causes of obesity that I had briefly mentioned just now, they are increasing in terms of the number of people who are involved. Let's take, for example, a decrease in activity.
Yeah.
A decrease in activity. Every country that gets more and more prosperous, the people are exposed to less activity.
Sitting on the computers all the time.
Right. They're sitting in their cars. They are sitting in their room watching TV. So the people who are more active, which are the less affluent members of the society, are much less active, predisposed to the consequence. Well, everywhere in the world, there's more wealth. Even the Chinese, you can look at it, they are developed. Actually, the rate of obesity developing in China is faster than anywhere else right now.
And the children watching the video games and movies.
And no school games. You know, we used, I'm sure you remember, we used to play soccer in school. You had to play soccer in school. You couldn't. Here, the activity is voluntary, you know, or they may not even get access to being able to be active.
So less physical activity is one of the causes.
It's one of the causes. It's not the main cause. It's not the only cause, but it is a significant cause. Of course, there is also availability of food.
Food, yes. What type of food is available?
You know, and a wide variety of food, and you can eat all the time. You don't have to wait for the 3 meals. You can eat in between. The social atmosphere creates the opportunity for you to almost continuously be eating. So that's and then there is the super sizes that we've created to even make people buy more and more. So these are the
physical
causes.
Activity, the type of food what we are eating, like a fast food.
That's right.
And a lot of soft drinks, right? A lot of Cokes and
a lot of carbohydrates
in it.
Not very useful food that we eat and drink.
Right. So in the children also the same dietary factors, the environmental factors, and the behavioral patterns probably are. Yeah,
because they copy the adult and if parents are people who just pick up some McDonald's on the way home rather than go home and cook really fresh vegetable and more nutritious meals, then they are also exposed to it. And in schools, until recently, people noted that you've got Coke machines all over the place. You know, they eat chips. You know, so we've not really cultured our children to eat good food for in a large measure.
So, what are the benefits of losing weight?
Well, the benefits of losing weight are really quite great. For the medical point of view, we actually have been able to assess that if you get any patient to lose between 5 to 10% of their weight, which is not what most people want. They want to lose 50%. But 5 to 10% of the weight results in major metabolic changes. For example, a patient who was, you know, it won't be really diabetic who's been 10 years in that, but a pre-diabetic patient can return to normal levels of blood sugars. Patients who have high lipid levels, cholesterol levels can return to normal values. So there are major changes in the biochemistry that one can demonstrate. Blood pressure goes down. You know, the amount of weight that you put your joints through goes down. It's been calculated, for example, in a patient who has knee joint pains, who loses 1 pound, that you reduce by 4-fold the amount of pressure on the joints. So there is a major benefit from just losing about 5 to 10% of.
So 5 to 10% of the weight loss can prevent diabetes, can prevent heart disease.
That's right. In levels of those the earlier levels of those diseases.
So that's a lot of benefit of losing the weight.
That's right.
So please tell us, what is the best way to lose the weight?
Well, obviously there are many causes of weight gain. And for you to be able to get a patient to lose weight, or for the patient to lose weight, there has to be more than just one aspect of a treatment. You have to have the appropriate diet. And there is not one particular diet that makes you lose weight and the others don't. You have to have a caloric intake. that is not excessive. Okay, you have to have some level of activity that helps you to try and burn the diet.
Let me ask you a question now
Right.
about losing the weight.
Yeah.
What should be the calorie value of the diet every day for the person who is about to lose the weight?
Well, we calculate it on the basis, roughly on the basis of your present weight, and the average, let's say it's about 30 calories per kilogram. So somebody who's 70 kilograms should really not be eating more than 2,000 calories a day.
Right.
Aside from, then you have to calculate how much you're going to be able to burn off and how much you'll be able to retain and all that. So it's on the average done. And if the patient is already overweight, what we do initially is to remove 500 from that calculation so that you now have a deficit.
So
a daily value of 500.
You are daily eating 2,000 calories,
and
if you want to, you are overweight, you want to
right.
lose the weight, then you reduce by 500 calories every day.
Yeah.
So if you lose 500 calories per day over the period of week, then you lose 1 kilogram. Is that
That's
right?
right. 3,500 calories.
Yeah. So you lose 3,500 calories, which is 1 kilogram.
That's right.
So if you want to lose 1 kg of weight, which is 2 pounds, then you need to reduce your intake by 500 calories for
on
the
daily
basis for a week or so.
That's right.
So what is the ideal weight loss amount? Like in a month, how much is the healthy weight loss?
We usually suggest, there's no number as such. We usually suggest that you do not drop off too fast.
Yes.
I mean, somebody who loses, 15 pounds 1 week and then 10 pounds, because the chances are that what you're doing is a drastic alteration from your normal. And the chances that you will maintain that kind of activity for a longer time is pretty minimal. And that's why the degree of return to the previous weight is more than 90%. So if people will do it for 6 months, they will lose weight and they come back to the previous weight.
So it's like a slow and steady wins the race.
That's right.
So lose the weight over the period of months or years rather than losing all of a sudden.
That's much better.
So reducing the weight, what sort of diet one should consume?
Well, you should consume a diet that is not overloaded. I mean, we sort of get into fats, or whether it should be low carbohydrate or low fat. Or unfortunately, in the past there has been a heavy emphasis on fats because of cardiovascular disease. Obviously, we had the mistaken opinion that the more fat you eat, the more you put in the arteries. That's not true anyway, but we don't want to go into the physiology. And therefore, if you don't eat too much fat, obviously what's left is too much carbohydrate, because you can't eat too much protein. I mean, by nature, the protein food cannot be overeaten because it takes a little bit more, and they are more expensive and all that. So we've got into the habit of eating too much carbohydrate, and that's partly responsible for the weight gain.
So too much carbohydrate is the cause of obesity.
Well, it's part of the problem with
and too much fat is also cause.
It's also a
obesity.
bad.
So it has to be a balance.
That's
problem?
right. There has to be a certain balance of the three components of food, in such a way that you don't overload one and underload the other one. And more important, because the experiments have now been done, or research have been done, in which a group of patients have been put on low carbohydrate, traditional low carbohydrate, and then put on low fat and followed for several months. Although the patients who have low carbohydrate tend to lose more weight initially, in the end, if you follow them for 1 or 2 years, they balance out. If they're as long as it's the same amount of calories.
Right.
So the number of calories matters more than what's in the caloric intake.
Right. Yeah. That's a very interesting discussion. We'll continue after a short break.
That's right.
Thank you. Please stay back for the last part of the show. Thank you.